Hello, so this is a video explaining Horner's syndrome in the dog and the cat. There is another video intended for veterinary professionals and vet students that has a more detailed explanation with case examples, whereas this is the simple and short version intended for caregivers of affected pets and for those that want a less detailed and quicker explanation. So to understand Horner's syndrome, we have to understand a little bit about the anatomy, and in particular, the sympathetic supply to the eye. The sympathetic supply is part of the autonomic nervous system, that's the involuntary nervous system, and it's involved with dilating the pupil, and it also innervates the eyelids to open them and give you that alert and wide-eyed expression, especially in response to stress or excitement. And so if an eye was under a lot of sympathetic stimulation, it would have a dilated pupil and would look very wide-eyed and perhaps frightened, which is why we often refer to the sympathetic system as the fight or flight system. Horner's syndrome is the complete opposite of that. It's loss of the sympathetic nerve supply to the eye, and you can see it in this cat, and the Horner syndrome affected eye is the one with the arrow. And in this, the pupil is constricted compared to the other pupil, so you have an unequalness in the pupils, which is called anisocoria. You have a protrusion of the third eyelid. This is something that dogs and cats have and humans don't, or at least we do. It's a kind of remnant, that red thing in the corner of your eye. So this third eyelid comes across the eye. The eye sinks back in the socket and the eyelids are more closed. So it looks like the animal has a smaller pupil aperture. And you may notice that the conjunctival vessels are dilated, which can make the eye look red. And many caregivers and even some vets can be forgiven for thinking that there might be a conjunctivitis there, but this redness is all part of the Horner syndrome. So Horner syndrome is actually quite a complicated anatomy, which we can easily summarize here because it consists of three separate nerves that are connected. It starts off in the brain, right in the center of the brain, and then it goes down the brainstem and then the spinal cord, and whereupon it connects to the next neuron, which comes out at the level of just the front part of the chest, so those first thoracic vertebrae. It comes out and then it sort of goes around the top of the lung, so within the thoracic cavity, and then joins a very important artery called the carotid artery and goes up the neck in a trunk, which we call the vagus sympathetic trunk. Then it joins and makes a connection to the final nerve, which then goes behind and then through the middle ear, and then enters the skull and travels with another nerve called the trigeminal nerve to the eye. So you can see this rather long, complicated pathway. It's possible to have a Horner syndrome with any damage along that pathway. And we call this the first order. The second order, which is sometimes called the preganglionic neuron, which means that it comes before this ganglion here, which is called the cranial cervical ganglion. And then the third order, or the postganglionic neuron. So what is the approach to Horner syndrome? Well, first of all, the vet needs to decide, is it a Horner syndrome? Because other things can constrict the pupil and potentially make the conjunctiva red. And the most important thing doing that would be an inflammation in the iris in here. But there should be other signs that would indicate that. Are there any other neurological deficits? So other neurological signs or signs of ear disease, since the nerve goes through the middle ear. And these other signs determine the recommended investigation or treatment. So going back there with these different localizations, if we had a problem in the brain, it's very deep in the brain, and that would give you other brain signs. Likewise, it's very deep in the spinal cord, and that would give you other spinal cord signs. If there was a problem in the chest, then we may have other signs, especially other things to do with the vagus sympathetic trunk. For example, might have a problem with the animal's voice or they may have some paralysis of their larynx. In the middle ear, we may have signs of middle ear disease, and otherwise we may have signs associated with the trigeminal nerve. So these other signs dictate where the problem is. And if the Horner syndrome is associated with bad disease, then there will be other signs, or those other signs will develop eventually, particularly if the problem is in the brain or the spinal cord. So if the converse is also true. If the animal doesn't have other signs, then that's a much better prognosis. So there's really two situations where you may not see other signs. Two main ones. The first is with cats. Cats are far more likely to have Horner syndrome with middle ear infection or following surgery. And that's really because of the cat's unique anatomy in this area. The dog, the sympathetic fibers are traveling just in bone in and around this region, but that doesn't occur in the cat. They actually are traveling through the middle ear. So once you get infection, and that's what is shown here. This is the tympanic bulla. This is the inner ear, and that's the outer ear, the bit that you can see. You can see that this bit here is black, and that's because it's full of air, whereas this bit here is not full of air, it's full of pus, full of liquid, and so is that bit in the inner ear. So this cat has an infection, and the fibers for the sympathetic supply to the eye that if you damage will get Horner syndrome, they are right sort of in this region here. So a cat that has a very acute onset Horner syndrome, the vet really has to be suspicious that it may have middle ear infection. Whereas in the dog, it's really unlikely that you'll get a Horner syndrome as the only sign of a middle ear infection. It's much more likely that the dog in that instance would either have pus coming out of the ear because they have an external otitis as well, or that they may have balance problems because of damage to the inner ear. If it's a dog and Horner syndrome is the only sign, then it's much more likely to be something called idiopathic Horner syndrome, where the cause of that is unknown. And your vet may want to do some pharmacological testing by giving a drug called phenylephrine. And the epinephrine there is the clue to how it works, because it is a drug which stimulates the sympathetic nervous system. And the Horner syndrome eye can be very, very sensitive to this, especially if it's a lesion or a problem that is very close to the eye, a third order problem. And if the vet gives a very dilute solution of this, then you can see a reversal of that Horner syndrome. However, that reversal can take a few weeks to develop. And I should say, for those thinking that this is a great way of treating it, that this reversal is very, very temporary. And we don't usually use this drug to treat Horner syndrome because it actually stings the eye when it goes in. And if it causes the pupil to dilate, then that is more impactful on the animal, because that will actually mean that the animal is unable to focus their eye and have more visual deficits. Idiopathic Horner syndrome is more likely in certain breeds, especially the Golden Retriever, also Labrador Retrievers, English Springer Spaniels, and possibly Beagles. And typically they're middle-aged dogs. The average age is about 8 years of age. Maybe more common in male dogs. It's usually only one side. I've never seen it go to the other side, and I've never seen a case that didn't resolve, although it can take up to 6 months to do so, and I've never seen a case that has had a recurrence of that. So what is our making sense of Horner syndrome? So you should present your dog to the vet if you suspect this. The vet will do a neurological exam to confirm the problem, to confirm that it's a Horner syndrome, and to localize it to a region of the nervous system. Now, to help them with that, they may suggest pharmacological testing with phenylephrine, and that may help confirm where that localization is. That neurolocalization will direct the vet to recommend other tests. For example, they may say that an MRI is advisable. And if there are no other neurological deficits or signs of ear disease, it's more likely idiopathic. And in that case, actually monitoring the neurological exam would be a low-cost alternative to doing an extensive MRI investigation. Because, as I've said before, if there is bad disease, then other signs will develop and usually will have been present already. So our take-home message is that Horner syndrome may be seen in isolation, which we call idiopathic, but it can be associated with many diseases along the route of the nerves from the brain through the spinal cord, chest, neck, ear, base of the skull, and the eye. And investigation and prognosis depends most on the other signs that are seen with it, not the Horner syndrome itself, or of course signs of ear disease. And if the pet is otherwise normal, then it's worth just monitoring the neurological exam, although of course if you want further investigation, then your vet may have recommended a MRI scan. Thank you very much, and I hope that has been useful to you.